This is Tom Lee, editor-in-chief of NEJM Catalyst, and we're talking today with Tim Dentry, president and CEO of Northern Light Health, the delivery system based in Bangor and serving the state of Maine. I asked Tim to talk with us today about two bold strategic moves Northern Light has taken in the last year. First, to form a strategic relationship with Optum, in which Optum would take over business processes like scheduling, billing, revenue cycle management, and IT. And a second partnership with Quest, in which Quest acquired selected parts of Northern Lights clinical laboratory operations. Tim agreed to talk with me about why Northern Light made these moves and how they're going. So, Tim, before we plunge into these topics, can you tell our audience a bit about Northern Light today?
Absolutely, Tom, and thank you for asking me to join you. I really appreciate this opportunity to talk about Northern Light Health. It's a system that really covers the entire geographic footprint of the great state of Maine, with the exception of the far western and reaches. We have 10 hospitals. We have over 1,000 physicians and a little bit more than that in terms of advanced practice providers, a very large home care and hospice service, which has had a great reputation and history over the years as well. We have about 11,000 employees right now, and actually I include the Optum employees in that number, so it's more like 12,500 employees that cover the state of Maine. And Eastern Maine Medical Center, as one highlight, is the only tertiary care hospital north of Portland. So it really has a very critical role to play in that vast geographic area that accepts patients in for tertiary referrals from not only our hospitals in Northern Light, but very many independent hospitals as well.
So tell us what led you to consider making these moves, and we should probably start with the first one first, the Optum relationship.
Good, Tom, and I'll start with a context that some people are advising me, we don't have to begin everything with, well, when COVID was going on and the pandemic was here and post-COVID, but I feel like it's a bit of still the elephant in all of our rooms right now. And so I just want to put that in context. The way that the Northern Light staff responded across the state was so stellar, and just with all healthcare providers, the true heroes of healthcare. And I said to all of my staff in those months and then becoming years that you've got the backs of the citizens of Maine and you've got our back, and now I'm going to make sure going forward we've got your back. So that's number one driving force, is having the back of our staff. Number two is, because of the economic challenges post-COVID, we needed to find a new cost point, if you will. We needed to make sure that we reduced our expenses, but not on the backs of our caregivers. So we needed to find ways to reduce our costs, but also make it more enjoyable, less stressful, more efficient place for people to work and bring their careers to Maine, because we really had some very positive inroads of people moving to Maine to work because they wanted to be in a less congested area to raise their families and provide their career. We've had some very good successes along those lines. So in putting all of those pieces together, as I was thinking and talking to folks and listening to folks, I saw this opportunity that one health system in California had started with Optum. And I thought it made perfect sense. And here's why, to cut to the chase of your question, Tom. With the Optum partnership, number one, we wanted to maintain our own independence. So we were not looking for partnership that would make us a minority partner or lose our identity. And number two, we wanted to do the things, address the services, as you had listed those, that are not necessarily behind the scenes. I don't want to emphasize that too much, because things like care management and some of the revenue cycle kinds of things are very much patient-facing. But the things that are supportive of the hands-on caregivers, That's what we wanted to address. And number three is not only reduce our costs and keep our jobs in the state, but also to create performance improvement plans where that would bring over the course of time the greatest advantages of adding efficiencies in all those areas that you listed, and improvements, and making sure that the investments that we made in both technology, which we've made tremendous amount of investments in technology, as well as in our campuses, really can be optimized and maximized. And one last thing I'll say on that, when I just mentioned our campus improvements, in the last 2 years, we have finalized on time and on budget 5 major campus development initiatives, starting with the hospital closest to you in Portland, Mercy Hospital, consolidating that campus, and our Acadia Hospital, our behavioral health hospital, doubled its beds, including mainly pediatrics and adolescents, really helping tremendously with the problem of ED boarding of pediatric patients. And 2 other hospitals, one in Blue Hill, one in Greenville, and those were over 100-year-old hospitals that we really needed to make new, and so we created new hospitals there as well.
Well, so your comments are really interesting. Clearly you felt you had to be open to doing things differently. You had to be open to partnering, but you didn't want to lose your identity and be absorbed into some much bigger organization. And you didn't think that kind of partnership was attractive, but you found that you could partner in some more focused ways, and you went down that road. Now, the big strategic thinking is one step, but then you have to actually work out that specific relationship. So maybe you can tell us, what is in it for the 3 critical parties in this area: Northern Light, Optum, and the 1,400 employees. How does the relationship affect each of them?
Yeah, very good. Great question, Tom. And I'll start with the most important, that is our employees. In fact, just last week, we had our 1-year anniversary. And so I had an auditorium full of our staff, not all 1,400, but about 250 or so, and the rest were working from home. So that's number one, is the job security for those staff that had those positions before started to transition to home, and we continued that for them. So the most important thing for them is the staff could keep their jobs, in many, many cases right now, have an even faster career development path because of all the different opportunities that Optum can provide. And they didn't have to uproot either out of state or within state, or even go to one of our facilities. They could continue to work from home. And so that was a very big opportunity for our staff along those lines. And what I said to the staff the other day is exactly what I said to you, and that is, we've always tried to show that we've got your back. And in our due diligence, if we believed that at the end of the day, when the contract's signed and we're 5 years into it, that kind of a thing, if we did it at the expense of our staff, then we have failed, and I was not going to proceed with that. So that was a critical first step. Then I'll list what's in it for Optum. Optum is a for-profit organization, has a lot of really good things that they've developed, and they're big business healthcare. So we're very cautious along those lines to make sure that we're partnering with someone that wasn't going to be throwing the weight around, if you will. So Optum is really good at staying in the lane of those kinds of initiatives, working with me on other challenges and difficult things to fix, like primary access is a challenge in many ways. We're trying to devise new solutions along those lines. But what's in it for them is, I think, to really show that they aren't just impersonal big business, but that they can work with a rural health system such as Northern Light in a way that strengthens our ability to perform, where they are secondary to that and not out in front of that. So I think that's really that's an indirect kind of benefit to them, but nonetheless a very important benefit that goes all the way to the highest levels of leadership along those lines. For Northern Light, the greatest advantages, I've touched on some of those, the aspirational things when we began this, is it truly has changed our cost in the very, very positive direction. It made sure that as we have promoted ourselves as having a great embracing culture of caring for our staff that starts with caring for one another, that all of our staff saw that, wow, we're keeping all these jobs right here. So Northern Light as an employer, our reputation and our attraction is still very, very strong by doing this. I think all of our caregivers realize that we aren't going to be the kind of health system that continues to squeeze them, but is doing something to help them and support them. So those are, I believe, the things that I would point to the most. And maybe one more example too, and that is in care coordination. We had such a difficult time with long stay patients that were in our hospitals for months and months, in some cases years at a time, because the post-acute health system has really suffered over the last couple of years. And through some processes and innovations and new data sourcing and things of that nature, as well as working with some outside providers and enhancing our home care capabilities and the like, we actually have made a dramatic reduction in our long stay patients, which allows us to care for the tertiary care acute referrals that are coming to us from the community hospitals. So it's made us far more accessible to the kinds of services that we need to have and free up those beds.
Now, it must have been hard to convince your board and your team to give up part of anything you already own. You mentioned a wonderful analogy about the brain of a bird when we discussed this in person a couple of months ago. Can you share that now?
I will, Tom, and thank you for reminding me of that. And one part first, and that is with our boards. When I had the idea that we needed to do this, I first met with my board and I gave them the idea, and I said, we're going to now spend probably the next 6 months doing our due diligence, our homework. I'm going to inform you along the way, even in its unfinished form, of what we're learning along the way. And when I think we're ready, if we're ready to present to you for approval, I'm going to let you know when that's going to be, and we're going to make our final presentation to you, and you'll make the final call. And so we did that, and it took about 6 months. So that was really key. Number one is gaining the buy-in along those lines. Secondly, I'm a very outcome-oriented leader, and so metrics need to be a critical part of what we do. And from that, we needed to make sure we had metrics, performance metrics, for every one of the areas that you mentioned in IT and supply chain and rev cycle and all of that. So we have really good dashboards that we present on a quarterly basis to our board. So there's all of that, as well as our member boards, we call them. So that's the 10 hospitals and home care and hospice board, so 11 hospitals plus the Northern Light board. We present updates on what is going on, and we listen to their questions and that kind of thing, so that they feel very well informed, because this is not an outsource. This is, yes, we have those 1,400 positions that were on the salary of Northern Light Health, and now we're on Optum, and they're dual badged with both Optum and Northern Light Health. So yes, that is different. But the people are still in the community, and that doesn't mean that it's a distant relationship, because that happens sometimes in outsourcing. We did not want that to happen. And now I'll circle into your second part of your question on the book that I had mentioned. And I have the book in front of me. It's called The Masters and His Emissary. The Divided Brain and the Making of the Western World by Ian McGilchrist. And when I was at a conference in California, and I was sitting next to the chief medical officer of the health system that already had partnered with Optum, and I said, "What's it really like?" And he mentioned this book, The Master and His Emissary. He asked me if I knew of it, and I said, "No, I don't know of that 600-page book. Tell me more about it." And he said, "Well, the basic essence is if there's a bird that's sitting in the middle of a field, the left side of the brain would be pecking, 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 looking for seeds, looking for stones, et cetera. The right side of the brain would be looking up in the sky for the hawk that's going to eat the bird potentially." So he said that we need to make sure that you don't count on Optum being the left and the right side of the brain, but that the health system needs to continue to be the right side of the brain, the one that's looking for the hawk, that's the one that's looking for the opportunities, the one that's not doing the routinized kinds of things. So as long as you make sure that you have that kind of partnership role, that's really critical. So that has really stayed with me. So we work the partnership very, very diligently. And they've been very good partners along those lines as we've challenged them to greater performance, greater transparency, less bureaucracy, less paperwork, because if the doctors and nurses and others see predominantly that and not results like less stress and more efficiency, less wasted time, then we're going to have a challenge. But if they see that things are lighter and different and our results are better, then that's a fabulous outcome.
I do love that analogy. Now, for the lab, you made an outright sale of your lab business to Quest, right? How is this partnership working?
Yeah, we really did, and that was in a very challenging time for us overall economically, and so it resulted in a one-time sale. So that really helped in terms of cash flow, et cetera. But that wasn't the strategy behind it at all. The strategy behind it was that in our huge disparate delivery area that we have, we had a large lab, but I wouldn't call it a centralized lab at Eastern Maine Medical Center. And then we had labs everywhere from Portland to Presque Isle and Blue Hill to Greenville. And so there was less consolidation, less standardization, less group benefit and things of that nature. And to pull all that together, we just felt, it's going to consume resources and time, et cetera, that there are partners that we can work with that's their expertise. So we went out for a proposal, and we compared proposals, and Quest did earn that way. And I would say that in the very beginning, we had some hiccups. The biggest hiccup was lack of compatibility of, guess what, the information technology between Quest and our labs. But we've worked all that through right now, and all the, again, metrics that we have, waiting times and turnaround times and retesting times and all that are equal to or better than what we started out with in the first place a year ago.
Now, my assumption is that you did not feel that either labs or revenue cycle management was going to be what really differentiated Northern Light from its competitors.
That's absolutely true. I mean, we have what we call our promise, and our promise is to make healthcare work for you. And we know that through COVID and post-COVID, that is very, very challenged. We've made some good inroads in improving our accessibility, but there are still, as there are in most parts of the country, pockets of areas of specialties, et cetera, where our access is very challenging and difficult. That's what we need to focus in on. And we need to focus in on the fact that healthcare was always stressful, as we know. And now, so even more post-COVID. And so we need to make sure that we're doing everything to address that. So let's put all of our energy into our staff and our people and the way that our service is conveyed to the consumers. And so that's got to be our focus. And anything that's outside of that core vision and focus, we need to look for partners that can help us with not only those areas that we've just described today that are going to be valuable and very added value to the whole organization, but also take a look at the things that are the most difficult nuts to crack and see if we can partner with an entity that can help us absolutely solve those really difficult, wicked problems that we all face in healthcare.
Well, maybe we can close with some comments by you on what you are looking for in organizations that might be a good partner to Northern Light, and what you have learned Northern Light must be in order to be a good partner to others.
Yeah, great question to close on, Tom, and I'll try to keep it short. I would say that these two examples point out the characteristics that we were looking for and that we have in a partner, and that is someone that truly will be partnership minded, sit with us at the table, figure out our problems, and figure out good, positive, efficient ways to have results. And knowing that we are the ones out front delivering the care. And so that's really what we're looking for in partners as we go forward, is someone that, again, is going to shine in the fact that we are a strong, viable, positive healthcare employer and deliverer within the state of Maine. So that's what we're looking for, and that's the characteristics of a partner. And great question as far as what we've learned through this partnership. And I would have to come back to the right and left brain and the bird analogy, and that is with both of those, we cannot be arm's length, because everyone is still looking at that. All the communities we serve, all of our local boards, the Northern Light Health Board is still looking at, okay, now we're a year into this. Are you delivering what you said you're going to deliver on? And to me, that's one of the most critical aspects of any leader, most critical personal aspects of my leadership, and that is deliver on what you say you're going to deliver on. And therefore, what we're looking for and what we've learned from all of this is a way in which we can provide great end results and deliver on what we say we're going to deliver, because we did our homework and then we've provided very transparent outcomes.
Well, Tim, I want to thank you for your time and sharing the difficult decisions you went through with openness for our colleagues in healthcare. I do think that partnering is an important competence for organizations if they're going to thrive in the really challenging times that we have before us. I think that your personal strengths combined with the culture organization made what you've done possible. I know it wasn't easy, but I'm glad that it's going as well as it is, and I'm hoping that you'll continue to share insights that may help the rest of us in healthcare learn to be better partners in the years ahead.
Thank you, Tom.